hi everyone. Karoline, myself, and Mackenzie, we're going to be presenting cataracts today.
So what is cataracts, or what are they? It develops when the lens in the eye, which is normally clear, becomes foggy. And when a cataract clouds over the lens, the eye cannot focus light in the same way that it usually would. And this leads to blurry vision and other vision loss, just meaning trouble seeing. And the vision change depends on the cataract's location and size. Patients can get cataracts in one eye or both eyes. But one eye typically will be worse than the other or develop, and then another will develop at a later time. And oh god, yeah, that's fine. No, that's okay. You can go to the next one. So the demographics of cataracts, most people start getting them around the age of 40, but somebody probably will not notice. They have symptoms until roughly the age 60. And very rarely babies are born with cataracts, and that is due to a birth defect. And then people are more likely to develop cataracts if they smoke cigarettes, live in an area with bad air pollution, use heavy alcohol, and have a family history of cataracts. And it's very common among older people, and more than 50% of people over the age of 80 have cataracts. And you can see by the picture. And typically when you see somebody who has cataracts, you can see like the bluish gray thing that usually covers the pupil, and that's what's being shown in this picture here. So what causes cataracts? The lens of the eye is mostly water and proteins, and as proteins break down over time, they hang around in the eye, and the lingering proteins can make the lens cloudy, and so it's hard to see clearly. And it's just typical unpleasant part of aging. Things that can speed up the formation of cataracts can be diabetes, steroids, common medications to treat conditions like arthritis and lupus, and then phenothiazine drugs such as chlormazepine, whatever, used to treat a variety of conditions such as schizophrenia and bipolar disorders. And then eye surgery or eye injuries, radiation treatment to your upper body, and then spending a lot of time in the sun without proper eye protection, such as sunglasses. Okay. And then to diagnose and test for cataracts, if a patient has cataract symptoms, they have to see an eye doctor, also known as an ophthalmologist, for a complete eye exam. The doctor will need to dilate the pupils to see inside the eyes, and during this test, special eye drops widen the pupil, which is the black dark part of the eye. And when the pupil is open, the doctor can check the health of the eye. They can see if there are cataracts or other problems present, and find out how much of the vision is actually blocked.
So I'm going to take over right now and talk a little bit more about the symptoms of cataracts. So some of the symptoms are, as Mackenzie has mentioned before, the vision that's cloudy, blurry, foggy, or filmy, sensitivity to bright sunlight, lamps, or headlights, glare, which is seeing a halo around lights, especially when you drive at night with oncoming headlights. Also, prescription changes in glasses, including sudden nearsightedness. Double vision is another symptom. You need for brighter light to read, difficulty seeing at night, meaning just poor night vision, and changes in the way that you see colors. Cataracts, usually they do not hurt, but they can cause discomfort by making the eyes more sensitive to light. Here on the right, we have a picture of a human eye with the bottom is after cataract surgery, and the before picture, which is on the top, as you can see the cataracts right on, pretty much like covering the entire like part of the eye. And on the bottom, we have a little picture of a doggy with cataracts on his right eye. So what is the management and the treatment of this disease? So if cataract symptoms are mild, a doctor may need to prescribe prescription glasses or maybe some contacts. Cataract usually worsen over time, so eventually a doctor would like to recommend surgery to remove the cataracts. Most people wait until cataract causes enough vision loss to be a problem, like making it hard to read or even drive. Sometimes people need cataract surgery to see and treat other eye conditions, such as age-related changes in the retina, tissue at the back of the eyes, or diabetic retinopathy. Here is a picture of just an eye drop, which can be sometimes some types of treatment for cataracts as well. So when a patient is in a very advanced stage of cataract surgery, it is very recommended. So the eye should be healed within about 8 weeks. The patient can go about daily activity as soon as the day after the surgery. The cataract surgery is one of the most safest and most frequently performed surgery in the US. However, the doctors will inform the patient about all the possible problems and outcomes that can happen with the surgery. The patient shouldn't feel anything during the cataract removal surgery. Afterwards, they may have a little bit of a mild and like pain and discomfort, but the doctor can give pain reliever to use for the first day or two after the surgery. So here on the right side, we have a picture of a little like cartoony cataract surgery and how it works in 3 steps. So you can see the eye with the cataract. So you're gonna make an incision a little bit on this white part of the eye. And this disease lens is pulled out. So here you can see the cornea of the eye, and then the iris, and then where the incision is made. And then you implant the insertion in the lens implant right in the area. And then the lens implanted into the position, and then you have new lens. So here we have an actual picture, like to the bottom left, of an actual like human eye and how the surgery for the removal of the cataract works. So what about prevention? So when it comes to prevention, developing cataracts is very typical part of aging. As Mackenzie mentioned before, there's a very high chance of the elderly population to eventually get cataracts. You can take a few steps to protect the eye health and slow the process of actually developing cataracts. So the first thing is going to be quit smoking. Also wear sunglasses and a hat with a brim to keep the sun out of the eye. So it's very important to make sure that you get a lot of sun protection. Get regular eye care and have the eyes dilated once every 2 years after the age of 60. And surgery may be easier if get treated sooner. Also, it's very important to make sure that the patient is eating a well-balanced diet in order to prevent the possible outcome of getting cataracts. And those are 2 references.